My name is Adam Harris, and I've been in practice since 1990. That's the completion of residency. There are a couple of things I think that make San Antonio Orthopaedic Specialists unique in this community and probably in most communities, is that we really focus on the specialties. We don't ask doctors to take care of a broad variety of different things. If it's something we don't care for, we find someone who is a specialist and refer you out. And we're not going to try and pretend to cover all specialties. We are going to try to cover every specialty we do extremely well. Frequently, I'll be asked, well, what would you do if I was your wife or if I was your brother? And my response to that is I make all my recommendations as if you're part of my family. And if I wouldn't have my family have or take this treatment or have this surgery in the same setting, I'm not going to offer it to you. When they come in, I get a snapshot. But they live with their problem 24 hours every day. So I have to have an understanding about how their problem affects them day to day, not just during the time that they're sitting in my office or walking down my hallways. We try to establish a culture, again, not only taking care of the patient as family, but taking care of each other as family. And that rubs off. So I get a lot of compliments about how wonderful the staff is or how this staff member or that staff member attended to their needs in a timely manner. I think one of the things that might be different in this office from other offices is that a patient who comes through doesn't necessarily get the care of someone who is doing the standard technique. You get the care of people who have developed the techniques, who have invented some of the instruments, who have pushed the envelope to improve patient care and improve the patient experience. I'm always looking for better ways to serve the patient. When we talk about the operating room, I was one of the first people in the community to use a long-lasting local anesthetic around the hip or knee that's being replaced, and this makes people a great deal more comfortable in the first 3 days after the surgery. I was also the first person to use a regional nerve block that lasts 3 months, and to my knowledge, I'm still the only one using this particular nerve block. So, looking for better mechanical pumps to help prevent blood clots. And so every step of the way we're trying to say, can I tweak the operation a little bit this way, a little bit that way, to make the experience better for the individual patient.